Good afternoon. Thank you. And Lieutenant Governor, thank you for those updates. While I've not been here with you at the press conference for several weeks while our case numbers were lower, which makes sense, it's important to know that the public health professionals that work with Tom and I at the Rhode Island Department of Health have continued to monitor and respond to this pandemic 24/7. As we have for the last year and a half, the Rhode Island Department of Health will continue to give the state of Rhode Island 110%. Whether it's the testing program that we're leading in the nation in, or it's the vaccination program, our support with employers to help ensure that they have what they need to advance policies that will increase our vaccination and testing rates, or just engaging with the communities that we know are hardest hit. That's something that we take pride in and something that you can be absolutely certain that we're always going to ensure you have the latest data and information so that you're equipped to do what's needed. Along the lines of what the governor said, as most of you know, the Delta variant is the major focus for us right now. From a science standpoint, the Delta variant is much more aggressive than the other strains of coronavirus that cause COVID-19 that we've had in Rhode Island. Just to explain that a little bit more, while someone who had one of the earlier variants of coronavirus might infect one or two additional people, now with the Delta variant, that same one person could actually infect 6 or 7 other people and make them sick. Because of this heightened contagiousness and transmissibility, we estimate that more than 75% of our cases are likely now Delta variant cases, this much more aggressive and contagious form, which the vaccine works against. It's why we've seen more than a 200% increase in our case rate over the last few weeks. An important takeaway, though, is recognizing the strength of our high vaccination rates. Our hospitalization numbers have not risen as significantly as our case numbers. That's what we expected. Our fatality numbers, thankfully, have remained essentially flat. That's exactly what we want and what we've talked about since the beginning. Vaccination keeps you out of the hospital and keeps you alive. This is because, as Rhode Islanders, we are doing a great job getting vaccinated. Together, we have more work to do because we're always going to give it 110%, 70, 75%. That's not enough for us. We want to get as many people vaccinated as possible. There's no reason why in Rhode Island we can't get to 90, 95, or 100% vaccinated, and we want to use every tool we have to promote that. The key message for people today is that the vaccines we have help protect against serious illness from the Delta variant. That's the number one message you want for your loved ones, for your coworkers, for your friends. If you're watching this today, if you are reading about the Delta variant in the news and want to know what you can do to protect yourself and your loved ones, the answer is get vaccinated. It's time now. Everyone who is eligible, that means people 12 and older, should be vaccinated. There's no reason why in Rhode Island you cannot. You cannot count on quote-unquote natural immunity from a previous exposure to COVID-19 because we didn't have Delta variant then. So the natural immunity that you developed did not include antibodies against the Delta variant. That's only increased within the last few weeks. Your number one protection right now is getting vaccinated. There is more and more evidence suggesting that this particular coronavirus, SARS-CoV-2, does not confer long-term immunity after natural exposure. So we want you to hear the message. If you've had coronavirus in the past, relying on that alone as the immunity to naturally protect you from the Delta variant is insufficient. The vaccine is another critical layer to add to that. And as we have been saying, the vaccine works against the Delta variant. That is our greatest gift. When we say that the vaccines help protect against the Delta variant, that doesn't mean that it is impossible for you to get COVID-19 after getting vaccinated. But what it does mean is what we've been saying all along. The vaccines are extremely effective at keeping you out of the hospital and keeping you alive. That is our critical point, and it's what we want for everyone, for all of our loved ones, to stay out of the hospital and to stay alive. Because it is still possible for someone to get COVID-19 after being vaccinated, particularly with the Delta variant, as we have seen and understand, testing is also very important for everyone across the board. We're leading the nation in testing. We have been for over a year. Take advantage of those resources. If you were vaccinated but develop new symptoms, get tested, even if you think it's just allergies or a cold. Another important tool, which the governor touched on, is masking. Masks continue to work. Nothing has changed to limit the spread of COVID-19. As time has gone on, the science and the data are making that fact clearer and clearer. And as we've learned more about the Delta variant and how contagious it is, why not use one of the additional tools we have to help protect yourself and your loved ones? People who are vaccinated have the option to still wear a mask indoors in public places. That's important to know. This is something that I'm doing now. Given that our community transmission rates have risen so significantly, this is a personal choice that I am making for my health and the health of my family, including my son, who is too young to be vaccinated. It's our responsibility to encourage that for all of you. I said earlier that you'll always get 110% from us, Rhode Island Department of Health, from what's needed. We're going to continue to do that today and every day going forward in providing you with the science and the data. We continue to make sure our website remains updated with the latest, and we want to be there to help you process the information and empower you to make the decisions that work best for protecting yourself and the people that you love. We want to make sure that you are equipped with what's best for you and your family. I'll wrap up by saying that we have the tools that we need. We've consistently talked about those three major tools: vaccination, testing, and treatment. They continue to be what works, what we know is out there, and we should feel confident in where we are as a state and the team that we have in place to respond to this increase and help make sure that you are equipped with doing what's best to protect your families. We absolutely will get through this.